It is safe to say that the doctors of ancient times did not have the medical knowledge our physicians have today. This episode is going to explore the doctors of ancient Rome, the theories that they based their medicine on, as well as their treatments. So let's start with some Roman medical theories. There was an early belief that disease can be caused by the vapours that arose from swamps. Due to this belief, Julius Caesar completely drained a swamp that existed near Rome in the hopes of reducing disease in the city. Ironically, although this belief was completely wrong, draining this swamp did probably reduce disease to a degree. As mosquitoes breed in stagnant and slow-moving water, it would have reduced the number of mosquitoes near Rome and therefore reduced the cases of malaria. The Roman physician Crinus was a doctor who lived in the 1st century BC, around the time of Emperor Nero. He was fascinated in astrology, and so he concluded that disease was caused by the stars. He would examine the stars and the constellations before prescribing treatments to his patients. There was, however, a physician called Terentus Varro. He lived during the late Republic, around 116 to 27 BC. He theorized that disease came from tiny creatures so small they were invisible to the eye, and that they entered the body through the nose and the mouth. This theory accurately describes airborne viruses. Unfortunately, the technology to test the theory, such as microscopes, did not exist at this time, and so the theory had little effect on Roman medicine. One of the most famous of all physicians in ancient Rome was Galen. He lived from around 130 to 210 AD. He would become the personal physician to 3 emperors, Marcus Aurelius, Commodus, and Septimius Severus. Galen followed the most popular medical theory of his time, Humorism. This theory stated that the catalyst of disease was what the Romans called miasma. This was the foul air that was produced by decomposing organic matter. In other words, bad smells. This foul air was just the catalyst. The actual cause was an imbalance of the humours of the body, created by the foul air. According to Galen, the human body contained 4 humours. Each humour was a fluid: black bile, yellow bile, blood, and phlegm. Each fluid was related to one of the 4 elements of the universe: earth, fire, water, and air. Not necessarily in that order. The theory proposed that an imbalance of these fluids caused not just disease, but also affected the patient's behaviour and temperament. Of course, it's worth mentioning that this theory is completely wrong. There is certainly a link between disease and decomposing organic matter, just not for the reasons that the theory describes. So, what were the remedies based on this theory? One was diet. Certain foods were eaten to counteract the particular imbalance that the doctor had diagnosed. A common treatment was bloodletting, basically bleeding. This may have been useful if the doctor was draining pus, but this was not always the case. Also, scenting and incense around sick people, in order to make the place smell nice and aid the recovery. The theory of humanism became the basis of Western medicine, not just throughout the Roman Empire, but into the Middle Ages as well. So despite these theories, Roman doctors would often prescribe treatments based on long-standing traditions. Today we might refer to these treatments as old wives' tales. Here are some odd examples. Eye ailments were often treated with a plaster made of egg yolk and ground with flies, although sore eyes were treated with boiled liver. Acne was treated by rubbing the spots with crocodile meat, and warts by burning cow dung and waving the smoke in the warty area. The recommended treatment for epilepsy was to eat dried camel brain soaked in vinegar. For gout and inflammation of the joints, it was recommended to touch a woman while she was on her period to feel better. And headaches were treated with the ancient equivalent of a used tampon soaked in rose oil and applying it to the forehead. The Romans, however, did have good knowledge of the benefits of the natural plant life around them. For example, garlic is a mild antibiotic and can be used to reduce inflammation. Yellowroot is a natural antiseptic. Teas made from the marshmallow root was good for a cough. And for constipation, cabbage. So, what about surgery? Were Roman doctors any good? Roman law actually forbade physicians from dissecting human bodies, and this included slaves. So, there was a restriction when it came to learning about the human body. Galen would sometimes use monkeys or pigs. However, generally, surgical knowledge was gained through experience. An apprentice would learn from an experienced doctor during real-time operations. Roman physicians could perform successful surgeries, such as the splinting of a broken leg or amputations. They could even remove cataracts. Even today, the operation known as a caesarean birth is believed to be named after the long-standing belief that either Caesar or one of his ancestors was born in this way. Rome's best defense against disease, however, was hygiene. Rome had clean water from those famous Roman aqueducts, and they took regular baths. Although the public bathhouses probably didn't change the water nearly as often enough. There were public lavatories with sponges for wiping and sophisticated sewage systems that would flow the waste out of the city. And the streets were often cleaned of its animal droppings. In fact, sanitation of a Roman city was far more advanced than compared to the sanitation of much later cities of the Middle Ages. Thank you for watching. I do hope you've enjoyed this episode, and don't forget to like, share, comment and subscribe. Have a great day.